Hormonal imbalances can affect men and women of all ages, and the symptoms range from weight gain to fatigue to heart problems. But you don't have to just live with it anymore. Joining me now is Dr. Russell Bartels from the Scottsdale Center for Women's Health. It's good to see you, Dr. Bartels.
Good to see you again. That's always a mouthful. I know
it is a mouthful, but you know what? We were talking bioidentical hormones, and it seems like a lot of your patients, they want to know more about it.
They do.
Are they coming in with the symptoms we mentioned, just fatigue? Do they realize that it can lead to some bigger stuff?
Yeah. They range. There can be a variety of symptoms, and sometimes women just don't know if it's their hormones or something else. And it's always important to rule out other causes for their symptoms, but hormonal therapy can really revitalize somebody's outlook and how they feel. And bioidentical hormones is a phrase that a lot of patients come in and they mention, but they don't always know what they mean by that.
Right.
And I think just the basic definition of a bioidentical hormone is a hormone that is identical in both structure and function to the hormones that your body produces on its own. And so when you give your body a bioidentical hormone, it more readily recognizes that hormone and can process it more efficiently and with fewer side effects. And most patients will feel better on the bioidentical hormones. Huh. And the way of getting bioidentical hormones ranges from creams to oral formulations, but I'd like to focus today on pellet therapy for hormone therapy, and it's something that is not new, although becoming more and more popular. A lot of patients are familiar with it, but I'd like to take this opportunity to talk about the pellets.
Well, we have one here, and it's so tiny. We actually had to put it on a book so you can actually see. I mean, look at it compared to your hand,
exactly.
to my finger. You can see how small that is.
Yeah, that's an example of an estradiol pellet. Okay, we do testosterone pellets as well as estradiol pellets. Okay. And they are placed through a very small little poke in the skin, virtually painlessly. We do a little injection of a numbing agent, and patients always say that wasn't as bad as I thought it was going to be. Right. It's really a painless procedure. And the hormones delivered transdermally through the skin in this manner have some benefits over other modalities such as oral or creams. For one thing, it's very convenient.
Yeah, you don't have to take anything.
You don't have to worry about rubbing a cream on nightly or taking a pill once a day. A lot of patients say, "Oh, I forgot to take my pills," and I feel the symptoms come back. So this is put it in and forget about it, and it lasts about 3, 4, 5 months for most patients, and they seem to get more rapid relief and more complete relief of their symptoms. And again, symptoms can be, hot flashes, night sweats, right. Mood changes. Those are very common for women through menopause, but also sex drive, energy, sleeping better. All these things can be impacted positively with the bioidentical hormones. But I'd also like to say it's not just for menopausal women.
Right.
We have patients, both men and women. Now, I'm a gynecologist and OBGYN, but when my female patients started feeling so good on the hormones, they're, hey, get my, can you take care of my husband, my boyfriend, with libido, energy, muscle mass. And so that's how I incorporated men into the practice for the bioidentical hormones.
Is it just a simple blood test to see if your levels are off?
Yeah, we always want to, again, rule out other conditions, but we do want to check your basic metabolic profile, your hormone levels, and adjust the dosing based on symptoms and blood tests. I mean, you can't really do it on either or. I think the combination is the way to go, so you can best tailor your therapy for the patients. But it's men, it's women of all ages, not just menopause. We have patients maybe taking birth control pills, and their testosterone is being kind of bound up by the birth control effects, and the birth control works well. Great, they don't have any sex drive.
Yeah, right.
So but they want to gain that back. So overcoming that can be done with the testosterone.
Do you find that it's usually when your hormones are off balance, it's more than just one hormone? It's all of them. Is it just one?
Again, for men and women. For men, it's relatively straightforward for the men with the testosterone. Okay. For women, it's usually balancing estrogen and progesterone. And testosterone as well. Yeah. But there are some other things we look into, like thyroid. You want to make sure that there aren't other issues going on.
Absolutely. So you do a comprehensive
exam consultation, which we're doing free for anyone who sees the program or tells their friend they want to come in and discuss hormones.
Okay.
It's just amazing. And next time we do this, we're going to have somebody come in who's had it done, because they could really, when you hear these people talk, how good they feel and how much it's changed their lives, and it's just amazing.
Yeah,
so.
I think people think they just have to live with it. So in some cases, they say it's part of getting older. This is what my mother had, but you don't have to.
I used
You
to be
don't have
guilty
feel
of
that way.
saying that sometimes.
Really?
When I first started, I've been doing the hormone therapy now for about eight or 9 years. I've been in practice here. And in the beginning, when I wasn't real familiar with these bioidenticals, those words came out of my mouth, and I feel bad about that now. But now I'm so, excited to be able to offer these therapies to patients. And again, men and women, and we've been doing this in my practice for about 3 or 4 years.
All right, thank you so much. So if you want to get more information, of course, about what we talked about and that consultation, it's very easy. You can go to the Scottsdale Center for Women's Health. Go to ScottsdaleBioidenticalDoctor.com. That's the website.
You got it.
Or you can call the number you see right there on your screen.